appreciate this opportunity to be here. And with your help, I'm looking forward to the discussions on this topic of PRRS management and control. So as an outline for this first presentation here, should get done in some time between 15 and 20 minutes. I'd like to share results from 3 studies with you guys, really quick, and then over along the presentation, talk a little about how we keep track of success in PRRS, as a lot of PRRS control and elimination is about setting expectations. And so the first point that we're going to talk about is define where we wanna and what we wanna achieve. And once we have a really defined goal, we can use some metrics to keep track of our progress over time. So when we talk about PRRS, we're pretty much talking about 2 things here. One, some biosecurity or bio-exclusion initiatives to be able to prevent introduction of PRRS in the herd. Or once PRRS is there, how do we control or eliminate PRRS? How do we achieve either stability in terms of producing negative pigs again quicker, or productivity-wise, how do we recover from the break? And for this talk, we're going to focus on this second point here. How do we actually control, eliminate? We're going to talk about some tools to get there. And of course, how to measure success. We like numbers. So when we talk about control and elimination, of course we know that we do have some tools out there. We still don't have the tools that work 100% by itself on either preventing the disease transmission or eliminating the virus from infected pig or populations in a 100% or consistent way. So when we talk about controlling, eliminating PRRS, we talk a lot about herd immunity. And so we're going to talk about some practical applications of that concept. So for that, talking about immunization, we talk about immunization and not, we could talk of vaccination, but we prefer the term immunization because today for PRRS, using vaccines is a way to build herd immunity, but not only vaccines. As you know, there are some production systems, some veterinarians, some producers that would rather use the resident virus inoculation as opposed to one of the vaccines out there. And in this study, briefly, we're not going to talk a lot about that, just this short slide on a study that we followed some 61 breeding herds that were acutely infected with PRRS virus and that decided to do herd closure associated with mass exposure or whole herd exposure using either a modified live virus or attenuated vaccine or their live virus inoculation, also known as field virus inoculation or serum inoculation. And we measure different parameters from those herds, and I'm going to share here what we found. So for the herds that were infected with PRRS and then that did load close expose or whole herd closure with vaccination, with the MLV vaccine, it took them about 33 weeks median time to produce negative pigs again, and we call that time to stability or time to negative pig, depending on their source. And for those herds, they recovered productivity levels 10 weeks after the implementation of the load close expose program. And you see here this yellow box is what I've been calling the silent PRRS, and it's where there's a long window of time here where you don't see PRRS activity because you already recovered productivity. And so by, if you trust your eyes, your eyes will tell, no, there's no PRRS here, we don't see, so our numbers look okay, pigs look okay, but there was PRRS still in there, in that farm. And so it was our hypothesis for that study that we hypothesized, I should say, after the study, that this time here can actually be shortened if management practices, internal biosecurity practices were kept, fully being implemented, so do not give chance for virus to keep circulating when the prevalence was low but not zero. And for, comparing here for herds that use the live virus inoculation or just serum inoculation along with herd closure, that medium time to stability was shorter, around between 25 and 26 weeks, but they recovered productivity after the herds that use the MLV program, so that window where you recovered productivity but virus was not circulating was shorter. And so, again, just highlighting two talking points from that I wanted with this slide. One, it doesn't mean that you recovered your productivity levels, that PRRS is gone. Really need to rely on diagnostic testing to assume that the virus is really not there. And the second point is that in a lot of those herds up here, there were many instances, I guess over 50% of the herds had one or two negative tests followed by a positive one. Negative test being using 30 piglets per testing. So another take home that we have with this slide is that in order to define that the PRRS is really gone, it's just not 1 point or 2 sampling point in time. Really need to sample a few times, a few weeks, and with enough sample size, not just 30, or sometimes people use 10, even less than 30. So need to really sample more aggressively to make sure that the virus is really not there, and so don't rely a lot on what you're seeing in the pigs. You really need diagnostics. And well, we also, after this study, hypothesized that viruses, the more virulent the virus is, the less time to stability was, just because of that relationship here of people tending to relax on biosecurity practices when there was no seen activity of the virus there. So we're conducting a second study, follow-up study right now, trying to replicate all this, but following only herds with 174 virus. A study being performed by Carl Betlett and Dr. Bob Morrison. And results are still preliminary, but kind of confirming this, that more kind of aggressive or virulent virus, they tend to have shorter time to stability, and the speed to recover productivity is closer to that of recovering time to stability. So as we said, production level was not a good predictor of time to negative, so biosecurity and management practices should remain strict until truly negative. Now, another important finding of that study was we compared how long did it take for farms to recover productivity levels and how long it took to produce negative pigs again, comparing two groups of farms: the farms that had prior PRRS infection in the 3 years prior to that break, compared to farms that were naive 3 years before that current break. And we found that what you see in this plot is the probability to reach stability over time in weeks. And You see here that so the red line represents the farms with some prior PRRS infection history, and the blue line is farms without PRRS infection history in the recent past. And you see here that most farms, all farms started, of course, positive. They were not stable, and then over time farms started becoming negative, right? What you see here is that the red line, which is the line representing farms with prior infection, those farms consistently they reached stability before the farms without any history of PRRS infection. So if you pick here the 50% line or the medium time to stability, the farms with prior PRRS infection, they reach stability with 26 weeks, compared to farms with no prior infection. The median time to negative was around 32, 33 weeks. So that brought us to the question, okay, so what we saw here is that having some prior immunity was beneficial. Farms with some prior immunity or prior exposure to PRRS, they recovered quickly. They started producing negative pigs quickly. They recovered productivity levels quickly. Does that mean we should go in negative farms and expose all of those, vaccinate those or expose those and build that prior immunity so that when they become infected, they would perform better? So that brought us to this second study that we just completed, which was to answer that question: is it economically worth it to preventatively vaccinate herds to build that artificial PRRS herd immunity? And in one side of the equation we have, okay, if they get infected, they would have a lower production impact, and also they will recover they would produce negative pigs faster. But on the other side of the equation, if we vaccinate those sows, even with attenuated virus, there is an impact on the pigs per sow per year, because it's a live replicating virus, and there is also an expected impact on growth performance. So we propose that to answer that question, this question depends on the frequency of virus introduction. So if you get virus introduction every 1 or 2 years, it would probably make sense. If farms never get infected or get infected every 8, 9, 10 years, probably not interesting to vaccinate. And to get the specific number, we used data from that previous study, also data from some field data provided by Dr. Clayton Johnson from the Mashoffs. And so what we saw in that study was that break even, how frequent should a farm break to justify the preventative vaccination? It depends on a few factors. This slide shows 2 important factors that we would like to highlight. It depends on the cost that the attributed cost of the attenuated vaccine on growth performance, or in the attributed cost of PRRS or modified live virus vaccine on the reduction of pigs per win per sow per year, or PSY. And in a nutshell here, using some estimates from Dr. Johnson and from the literature, considering, just to keep the message more simple and straightforward here, considering the cost of attenuated PRRS on being about 1.5 pigs per sow per year, and about $1 in growth performance. If you look at the growth performance closeout data, the break-even would be about almost 2 years, meaning that if the farm has a history, or looking forward, if it's expected to break every couple of years, it was economically worth it to vaccinate, considering that those farms would recover productivity sooner and start producing negative pigs sooner. So, so if they broke more in a frequency higher than 2 years, probably not worth it to vaccinate. But anyways, this study was published. We're happy to share the model, and each production system would have their own numbers to be plugged in. Based on their experience and their viruses and their history, what do they want to attribute as impact of a live virus on growth performance or PSY, and then we could work on those in a specific herd level basis. So ways to compare what's the best strategy. We talked about live virus, we talked about vaccination, and I think one of the points here when we give presentations like this, we use averages of lots of herds, or even sometimes national averages or estimates published in the literature. But we understand that each farm have their own history, their own characteristics, and their own targets, right? Not all farms define PRRS success the same way. For some farms, for example, if we're a multiplier, or for some other reason, you might want to produce PRRS negative pigs sooner or as quick as possible. But from some other farms, you want to, for budgeting and logistics concerns, you want to achieve that number of negative of weaned pigs that you had prior to break sooner, or you want to recover your productivity sooner. Some other systems might prefer to, I don't care about any of those, I just want to see how many pigs I did not wean because of PRRS. So first step is when we define where we want to get, then we would talk about the possible strategies or practices or methodologies that can be implemented, and we know that the success of those, or the effect of those practices, or the combined practices on the success will also depend on each herd, their own history, their own characteristics, their size, and all the other possible interaction points. So when we give presentations like this, we need to select some, and we oftentimes talk about averages and medians and stuff like that, but we also like to highlight that going forward, when we talk with specific producers or situations, we talk about what we call a precision veterinary medicine, which is, let's talk about the solution for that specific herd. As today for PRRS, we still don't have the silver bullet that answer all the different questions, right? So the second part here will be quicker, just a few slides to share some quick study that we did. We presented that at the Lehman conference with people, with friends from Iowa Select Farms and from University of Minnesota. We were interested to assess what was the economic impact of 174, specifically the 174 kind of family of virus, on the wean to finish health and productivity. So the goals here for that project, for that field study, was to understand what was the relative importance of each risk factor or parameters on wean to finish mortality, and we also wanted to specifically answer the question of what was the impact of the effect of 174 virus. Because the impression was that after 174 was introduced in a few batches, it was kind of more severe. Was that true for that particular system? Then we designed this model where we combined information from different sources, including weekly PRRS status from each sow farm of the system, and that we did that for PRRS and for PED. Some selected sow farm parameters. I'm going to show some significant numbers in a little bit, and some selected management parameters, examples, type of killed source, and some other management-related risk factors. And we combined all that information to each line of each closeout line. So combine that with the growing pig performance data. Started with over 2,000 closeouts, and then to be able to answer the questions that we were after, we decided to let's focus on single source win to finish flows from single source sow farms ended up with 460 some closeouts, 2.3 million pigs from 33 sow farms, where we had the weekly production, weekly health status, and so on. So we came up with a list of different parameters here, the ones that we anticipated that could be significant, some that we anticipated were, some that were anticipated were not, but anyways, we built this model and take homes here for 174, so we were able to compare what was the growth efficiency. Let me go back. For this slide here, we looked specifically in the mortality. So the mortality ranged, you see here, from almost 0% to over 40%. And we compared here those three different buckets. The closeouts coming from stable sow farms. We define as negative here for the purpose of this study. Closeouts coming from PRRS positive but not with 174 virus, and the PRRS positive with 174, we call the bad PRRS for this study. And we showed that the mortality was actually confirmed to be higher with the 174 infected closeouts. Just plotted over time here, so we see here mortality over time. And we wanted to see if that, if it was just one point in time, just one quarter or so, that mortality due to 174 was higher, or if it was something that was consistent over time. And you see here that the green plots representing the 174 infected closeouts, they were consistently higher regardless of the time of the year. So we had here from quarter 2001, 2014 up to quarter 2 to 15. And so this is what we found in our model. We could talk a little bit more about that if you're interested, but overall mortality, we're interested to see if our model actually predicted the mortality. So if we look back retrospectively, our model had 81% correlation, meaning that we could, given the information of type of PRRS virus and weeks on PRRS status and some other variables that we plugged in the model, we could actually predict what the mortality was based on this information. So for the numbers here, the 174 infected flows, they had a 4.8 point higher mortality, which was equivalent to around $2.87 per head in profit. That was impact. And so, last slide here, final comments. Biosecurity, didn't talk much about that, but there's a lot of room still for improvement and put more science and numbers on biosecurity. We have some ongoing initiatives to be able to do models like this that we just described for mortality. We want to do that with biosecurity, seeing if we can predict number of breaks and time to recover breaks based on biosecurity scores, trying to see if we can do that with short assessments or full assessments. Anyways, there's a lot of opportunities on biosecurity yet that we are exploring. Definition of success for PRRS varies. When people say, no, we don't have the solutions for PRRS, well, we like to say that let's just define what's success. Different people, different production systems have different definitions of success. So first step is defining where the goal is, and then let's select the strategy to get there, and keep track over time using some of the metrics that we described here. Well, PRRS is smart. We know that it has a rapid mutation rate, so it's a moving target for vaccines. But we believe we do have ready-to-go tools that they don't give the full answer that we want, but they do significantly improve some of those metrics that we talked about. So it's pretty much talking about precision veterinary medicine, and understanding where is each specific herd, where they're at right now, and what are the risk factors that they have that we understand, and where do we want to get, and make a plan by herd basis.